to, right, is the male external structures that share some female counterparts. So this shows the external genitalia. So here is our typical bipotential, neither male, neither female embryo at about 6 weeks. Let's point out some structures. They have names, but they're not going to be male names or female names. They're actually usually a combination of the two names. There's something called the genital tubercle here. That actually has erectile tissue in it. That is the corpus spongiosum tissue, is what's in that. There is a groove here called the urethral groove. Inside of it is actually an unformed urethra. The urinary system at this point is not developed yet, so we don't have the urethra and all of that present in there. Surrounding that urethral groove is a little tiny fold here called the urethral fold. And there are these two larger swellings on either side called the labioscrotal swellings. And as the name implies, those are either going to be labia majora in the female, right, or form the scrotum in the male. Now, if there's no Y chromosome, okay, and no testis determining factor, the development is toward female this way. Right, so the external genitalia, you can notice if we trace the genital tubercle, will regress a little and become the clitoris. And it's still erectile tissue, it's still that sort of developmentally, it's the analogous to, in the male, the glans penis or the head of the penis. It's that kind of corpus, the expansion of the corpus spongiosum around the urethra. The urethral groove, okay, will open, and the urethral folds will become the labia minora. And as the urethral groove opens, the urethra will exit in that urethral groove. Okay, so the urethra, the urine, where urine will exit, is in this urethral opening. Now, just posterior to that, we would have had the development of the vaginal canal and the uterus occurring simultaneously, and the vaginal orifice would appear in that same vestibule, right? So remember in female anatomy, what is contained, the region that's contained within the labia minora, we call that the vestibule. And what's in that, which is just a pouch, right?